Good afternoon, Doctor. Thank you so much for coming and joining us for a few minutes to talk to us.
Thank you for having me.
Of course, and we appreciate your coming and attending the POSE 2025 conference. It's the first one that 1Cell.ai has put together, but we expect to have many more in the future.
Sure.
So thank you so much again. Just a few questions. I don't want to take your time too much away from the conference. First question is if you can introduce yourself, tell us which institution you are at, and share a little bit about your medical journey.
Okay, great. My name is Yüksel ÜRÜN. I am medical oncologist from Turkey, from Ankara University. I do my medical education at Ankara University, and also working for some further deepen my knowledge, especially in genitourinary cancer in Dana-Farber Cancer Institute in US. And my predominant work is for genitourinary cancer. And I see any type of the patient with genitourinary cancer and doing clinical trial, research, and more.
Okay, that's good. So in your experience, I'm sure you have been practicing, or you've been for how many years? How long?
It's almost 20 years. More than, yeah.
So you have lots of patients.
Yeah, sure.
Right?
Of course.
So is there any patient or any situation that you comes to mind where you have used classical clinical diagnosis and been able just only classical clinical diagnostics, we're not talking about genomic profiling, and be able to treat the patient just with that clinical diagnosis information?
Actually, in last 20 years, so many things change. At the beginning, we treat our patient with very few information about them, and we treat every patient almost in the same way. But
and what
today,
what would that say?
it's mostly chemo. It's mostly chemo. But now, in a precision medicine era, now we need more information about the patient, because we all see many different patients with same clinical picture, but the clinical course of all those patients is totally different. I remember several patients, let's say, present with 1 centimeter tumor, relapse very quick. And I see many patients with advanced diseases, with lymph node metastasis, and after surgery, still disease-free. So we all know that the present tools we use for both diagnosis, follow-up to our patient, it doesn't show us all the pictures. We need new tool to be able to have more knowledge about the disease, to be able to diagnose earlier, and to be able to track properly.
Absolutely. So you segued into my next question, which is, now that you have so many technological advancements by several companies, including 1Cell.ai, what in your mind is what you think is the future with all of this advancement, and how treatment decisions are going to be changed, or is going to be more accurate and be more targeted? So how do you feel that? What is your feeling on that?
Actually, for sure, this is the future for our patients. I think we will be able to treat our patient more precisely. But I think the problem with today, it is not available and accessible to all our patients. Of course, it helps us, both technology, AI, knowledge, it's all for better health. As a person believing on global health, and I think it is as much as important to availability, also to be able to have accessible technology for our patients. But I think in the coming years, we will want to treat our patients more with personal treatment, more precisely, and for that reason, we need more information about the tumor. We need more information about our patients too. And I think this is the only way. We need more genomics data, more phenotypic data for our patient to be able to treat them properly in a best way.
So that's awesome. I mean, you hit the nail on the head, because basically that's it. Part of that question is, how about in Turkey, specifically in Turkey, is it affordable? How does it work there? I mean, people pay out of pocket, is it covered?
Yeah.
And so do you feel affordability in addition to accessibility, is affordability
Of
something.
course, we have several tests. We have several in-house tests. Also, in our institution, we have some tests, some in-house tests we can order. But I think there is still barrier, there is still limitation because we need more information. I think we need. There is for two reasons. One, for treat patients at the present time. Also, to be able to accumulate, gain more knowledge. Because if we have more knowledge, like a more library, more picture about the diseases, more snapshot in the future, we will be able to find new targets for treatment. This is not only treat only one patient. Of course, every patient is unique, has a unique journey, and our aim is to treat them in a best way. But also, in global aspect, we try to improve our treatment armamentarium for all patients. So from one patient to global perspective, from the tumor, from the one cell. This is our aim to cover all aspects of the tumor.
So
And still it's not affordable enough. Also, it's available. Still, patient need to pay more out of pocket. But of course, we have several tests, but I think we need more accessible and more affordable tests.
That's wonderful. So that, obviously you are working with onecell.ai, and you've been, so hopefully we'll be able to come to a point where we can provide that. And the goal is for us to do
Of course, goal is same.
Yes.
For all of us.
Together.
Yeah, for all of us.
Thank you so much for your time. I really appreciate it.